This is the Core, Care, and Cure Theory by Lydia E. Hall. Core, Care, and Cure Theory by Lydia Hall is made up of three core concepts in respect of the name of the theory. They are an overlapping model that is kind of a synergistic idea of all three are always working together to take care of the patient. As the nurse will use the three as to take care of the patient, but at different phases of their disease process, one will be more dominant than the other two. So if you think about it as an initial acute phase, the cure or the disease is more dominant than, let's say, the core or the person or the body, or the care. So, so in an acute phase, let's say you come in ER, heart attack, the nurse will be working with the physician to intervene to open up coronaries in the cath lab or start a nitro drip, something like that. Whereas later on, after the intervention has been done, care is more dominant, and that's working with the patient, bathing, intimate body cares, education, teaching for discharge. And then core, you have to think about as the person in the therapeutic use of their education they've received about their disease and disease management to move on further in life. So that is more, the cure is much more acute phase, where core is more long term, going home, taking something for the rest of your life to control blood pressure, understanding the implications of that. And care is more of the post acute phase, like transitional area of getting out of the hospital. So once again, we're just going to touch on these three topics that are the foundation of the core, care, and cure theory. So core, use of relationships for therapeutic effect. So once again, we're speaking about emphasizing social, emotional, spiritual, and intellectual needs of the patient. Developing comfortable relationships so that the patient can explore ideas of who they are, where they want to go, what it will take to get to the goal that they are trying to achieve for recovery and rehab. And Hall really had a lot of beliefs, and patients would emerge as a whole person through this idea. Then we'll talk about care here. So care is speaking about intimate body care that nurses provide with patients in the setting of disease process. So once again, someone who needs bathing instructions, help feeding, toileting, dressing, discussing how to maintaining a healthful environment. And these were ideas that she believed belonged exclusively to nursing. She felt that this was a natural and biological foundation to people. And finally, cure, which she kind of split into two different views. One, she felt that it was more a medical aspect of nursing, where a nurse assists a physician with medical tasks or interventions. So, like, let's say a physician's in surgery, we're in surgery assisting. The other view was that she saw that nurses would be helping the patient through their medical surgical or rehabilitative care in the role of a comforter or a nurturer. So some strengths and weaknesses on this theory. First, talk about strengths. This theory of care, core, and cure, the patient is much more, the care around the patient is focused solely upon them. It's not an order set. Each model of caring for this patient is exquisitely made for the person who needs rehab. It also fosters learning for the patient, developing growth as an individual for the patient, and then this will allow them to heal, so they can essentially get back to a certain level of life that they want. Also, it's much more nurse-driven instead of medicine-driven or physician-driven cares. Some weaknesses of this theory would be because it's essentially owned by nursing and we're driving the ship. Ancillary staff has to buy in. So, physical therapy, occupational therapy, speech, case management, physicians, they all have to buy into this. Obviously, there's going to be a lot of difficulty getting everyone to participate. They have to put the patient first instead of their own recognition or ego. Second weakness is Hall really had set a high bar for the nurses that she had employed at her rehabilitation center. She felt that the nurses who participated in this really had to have a great level of professional ability and education. She had a program when people would get hired, and they expressed to them how they did their rehab, that it was nurse driven, and you would get educated on her theory and how it worked for the patients. Lastly, now modern day medicine obviously is economically driven by physicians and procedures, reimbursement through Medicare, Medicaid, which obviously drives a lot of how hospital medicine is performed. There is not much of an economic incentive for this theory other than it saves money. However, it doesn't bring as much revenue in as some physician who is doing procedures or ordering diagnostic work for a patient. So the obvious is more modern healthcare is based on the incentives of favoring acute care settings. Real life application of this theory. So there was a article written in the International Journal of Nursing and Health Services about patients with cardiovascular disease, and I believe this was in Jakarta, Indonesia. And they looked at how to treat patients with cardiovascular disease with an approach using the care, core, and cure theory. So looking at how care can be applied, they approached patients with cardiovascular disease and looked at the management of their risk factors. So they looked at modifiable risk factors such as hypertension, dyslipidemia, diabetes, and smoking, and figured that with being able to modify that, they would be able to essentially make some type of education towards these patients. And that's where the core would come in, was once they identified patients, you could increase patient awareness through disease explanation and treatment goals. So once again, identified patients with the care aspect, with the finding risk factors, and then with core, they would educate the patients and explain treatment goals and determine that if with this, patients would need less medical treatment and professional care based on having educated about their disease, so they could achieve their maximum potential of physical activity or whatnot that you have through learning of living with this disease and its limitations. And then finally, cure was more of looked at the cardiovascular disease as a two different factors, like an acute care factor where their cardiovascular disease essentially put them in an emergent situation, and then a non-acute phase. So an acute phase would be patients coming in with arrhythmias or some type of heart failure, fluid overload, and they would have to acutely manage the patient. And that falls under, once again, the cure aspect, where a nurse is working with a physician to treat the patient. And then a non-acute phase would be after the acute phase. The non-acute phase would take more of a dominant position, where this is where, like, you're taking a lifetime or long-term administration of a drug or some type of action with your heart failure or your cardiovascular disease. So that's where a cure is more about managing something medically than the other two applications of the theory. Thank you.